We want to welcome Dr. Michele Jorgensen out to the podcast today. She is a biological holistic dentist. She's also a therapeutic nutritional counselor and a traditional naturopath. So welcome today, because there's a lot of people when we talk about dentistry, they don't know what the difference is between a regular biological dentist and a regular dentist and a biological dentist. They just kind of think that they're the same thing, maybe just do something
Well,
a little bit
most
more
people don't even
natural.
realize that there is a holistic aspect to dentistry at all. So we're, and I honestly, we didn't realize it this is our world till a couple of years ago. So it's how long has biological dentistry been a thing?
Well, it's not even really an official thing. It's just a way of practice considering the entire body. And so it's been around for 20 years or more. There's been some pioneers who definitely have led the field, but it's becoming more and more mainstream every year.
Right.
So when Shane went to chiropractic school, before we left, I actually went to dental assisting school. So when we moved to California, I was a dental assistant for 4 years. And you could definitely see how when you're working with a tooth and you start cutting down the structure of the tooth, how that can really create a downhill effect. And so later on, I had broken a tooth, and I did not want to have to go the regular dental route, because I had seen what happens when you start messing with the structure of a tooth. And so I actually sought out a biological dentist and was so happy and so glad that I was able to go down that route, because I know, I don't know everything that you do compared to regular dentists, but I know from just my own eyes and the things that I saw, what the trail that I did not want to go down. So do you want to kind of like tell us a little bit what it is, how a biological dentist is different than a regular dentist?
Yeah, and I think it'd be really good to start with a little bit of my story, because that really highlights a little bit about why I'm here and the differences. I was a general dentist. I've been practicing for about 12, nearly 15 years, I guess, and started having a lot of health issues. And like anybody, I just started looking at every possibility, went to every doctor, every test, and was running into a whole bunch of brick walls. No answers, no ideas. So I changed everything. We changed our lifestyle, we changed our diet, we changed everything that I knew to change. And some things improved, but not everything. I was having some really severe memory issues. I've always had a very good memory. And I got to the point where I couldn't remember a patient's name from one room to the next. But the real concerning piece was that I had really bad numbness in my hands, to the point that I literally couldn't hold the dental drill anymore. So I was to the place where I couldn't do my profession anymore. Had my practice for sale, but I didn't know what I was going to do. I had another 20 years to work, and I support my family through this profession. And so I was asking a bunch of different colleagues what I should do. Should I consult? Should I be a coach? What are some options? And one said, well, you sound a lot like me. Have you looked into mercury poisoning at all? And
I was going to say that when you start saying that.
Yeah.
Well, Liz remembers just mixing up the amalgam fillings in the back. There's no mask, no nothing, all those fumes. I'm like,
no.
And and some dentists use dams, to keep it from going. But I worked for a really older traditional dentist, and I would just see some of the amalgam would go down their throat, and there's just a lot of things that.
Not just some, all. Yeah, and people don't realize that those fillings are 50% mercury. They are today,
they're called
forever.
Fillings. They're
we call them mercury fillings in our practice, because it's the majority of what they are. Yeah. So I had never thought that could be a problem, because I don't have any of those kinds of fillings in my mouth. So I said, well, I don't know what you're talking about. And he said, oh, it's not the fillings you have. It's the fillings you've been drilling out every single day without any protection.
While you're breathing that drilling. And
every single day. So a patient, it's concerning for them, because the ones that they have in their mouth, but I was breathing in every patient's, not just one patient's, but every single patient's fillings that I was drilling out, I was breathing in. So that's exactly what it was. Mercury toxicity off the charts. So I had to figure out how to continue being a dentist and remove these mercury fillings, because that's part of my job. So I found organizations that were doing this, that have ways to remove it safely. And what's that?
I was gonna
And a standard, yeah, they have standards. They have ways to do this.
well, standard dentists, just your basic regular dentist does exactly what you were doing before. They're
Oh
just
yeah, that's what I was.
the fumes are going everywhere,
Yeah.
into the
Yeah.
person, into the dentist, into everybody.
Yeah.
There's not the safety that a biological dentist goes. I mean, you're like in hazmat suits kind of thing.
Yeah. So I had to learn that's what I had to do because I thought, well, if it's affecting me, it's affecting my team member, my dental assistant, like you said, Liz, you know, my dental assistant sitting right next to me, it's affecting them. It's affecting the person answering the phone at the front because it's all in the air system. It's affecting every patient that walks in the door, whether they have a mercury filling taken out or not, because they're breathing in everything that's in the air. As soon as you walk in the door, you're breathing in everything that's in the air in that dental office.
Yep.
So I realized, okay, that there were some organizations that have standards and protocols to remove mercury filling safely. But for me, that was just the starting point. I thought, boy, if my profession hasn't protected me or its patients from this, what else is there in dentistry that could really be harming our health or contributing to poor health? And it has sent me down a pathway I'd never expected. I've since written a book. I have an online academy to teach dentists how to do this kind of work. I have an entire education series that we do for patients everywhere. Because I've learned that there's so much to dentistry. In fact, there was a recent book written that estimated 60 to 80% of chronic disease is either caused by or contributed to by some sort of dental issue, be it metals. So lots of heavy metals, particularly mercury in the mouth, but there's also metals in crowns that people don't realize. So metals is one. Infection is the second biggie. That one's root canals. That one's root canals, and it's silent infections that people don't realize. The silent infections, root canals. That's a whole big long talk I could talk about for hours. But these infections are harbored in the bone, and it doesn't hurt because the nerve's gone now. You've had a root canal; it doesn't hurt anymore, and they affect things that you can't even imagine downstream. Every organ system in the body is connected to the mouth in some way.
Yep.
So when you have a short or a problem, whether it be a hidden silent infection, a metal on that same, I call it shared lines, it affects everything in the body. So literally 60 to 80% of chronic disease can be contributed or caused by these silent infections or the metals that are living in a mouth. So that probably covers every person listening to this right now, to some degree.
So when did you go and get your naturopath? When did you do that?
I just finished that actually. So I became so interested in this that I started learning nutrition. I actually have 3 different certifications on nutrition and autoimmune disease issues, and thought I need to even take this further. And so now in my practice, I employ 5 other dentists because this need is so huge. So they are doing the majority of the dental work now. And I am the one who does all of the nutritional pieces, the overall health evaluation. When you come to our office, you have no idea that you're at the dental office because we do an overall health evaluation. We do everything from vitamin D testing, stomach testing, adrenal issues, all the way up and down. So those are the things that I'm really addressing and then saying, this is the piece that's dental related that we anticipate is dental related, but these are the other pieces that you need to take care of. And we have a great network of doctors that we work with, that we cross refer with, and we share. We help patients get complete care, not just one piece of the puzzle.
Yeah. No, that's awesome. But yeah, so you just like going to school apparently.
I do. I'll never stop. I either I'm going to school or I'm creating a school myself. I think I just wrote an enormous a 9-page research article over the break, while we're all sitting home, that's been circulated now through a whole bunch of dental networks and things, and all about dental ozone, because this is a whole different topic now. This is a different podcast interview because of where we're at right now. Dentistry has an interesting dirty little secret, and what it is called an aerosol. So anytime we do dental procedure that involves water of some sort, so water coming out of the dental drill, or water coming out of the cleaner, the ultrasonic cleaner that the hygienist uses, that's creating an aerosol. Well, aerosolized droplets contain anything that's been in the mouth. So if someone has some sort of infection, and in years past, it's always been all the other things we've worried about. Now it's COVID-19. Right. If that happens, it's now aerosolized into the entire office. So dentists have a duty to learn how to control the spread of this infection, because this is now forefront, front of mind for everyone. So we do a lot of things differently in a biologic dental office. And I'll tell you, there is no quote unquote a certification or licensure or regulation for what a biologic dentist is. That's one of the troubles with this, is
Oh, I
there's
thought
no
there was.
standard.
I thought there
Nope.
was a course or something that they did. Was it just, it's just themselves learning and going that
And
route?
implementing.
Exactly. There is no standard. There is no standard licensure. There is no residency. There is no, anything like that. So you could call yourself holistic biologic dentistry just because maybe you use a rubber dam, like you were saying, use a rubber dam when removing mercury fillings, but there is no standard for this. So that's part of what I do in my book as well. And it's on my website, it's everywhere. I say, if you're going to go to a dentist, ask these questions.
Mhm.
Ask, do you do this? Do you do this? Do you do this? Do you do this? Because you want to make sure that you are getting your health improved, when you go to a dentist. And there's so many things there at a dentist that can really make a difference in your overall health. In
So just
fact,
quickly, what are 3 or 4 of those things, would you
so
say?
for sure, safe mercury removal. So if you're ever having a filling removed, make sure it's done safely. That's going to be with a great big vacuum at your chin, a special mask, something covers your face, something covers your body, a rubber dam in your mouth, a lot of different things. You'll know when it's being done that
I
this
know
is
when
very different.
I actually had all of my silver teeth taken out, my silver fillings.
Mercury feeling.
Good.
Mercury fillings. I had those taken out, and you get gowned up.
Yep.
And the doctor and the dental
Yep.
assistant, everyone in that room is totally um, draped up, and they have gas masks on, and they have a vacuum that's grabbing.
You know what's crazy
stuff,
though?
so.
A lot of dentists don't even know that this is a thing.
No, I didn't know it. I had no idea. And so many dentists I talk to, they say, really? That could be a problem? Yeah. But you have to get deathly ill before you find it. So the profession they're not going to change. There's too many reasons that I can go into that, but I won't.
Yeah, I mean,
Patients need to find their own way.
Nothing wrong with the amalgam fillings,
Yep.
though.
And they always will. I'll just say the ADA is never going to change its stance on that. So patients need to be one that really look for this.
Well,
so that's one thing.
Sued really bad.
That's exactly right. Class action lawsuits for every dentist who's ever placed one. Yeah, they will never change. So that's one thing. Another thing really should be involved in the dental exam should be a CT scan. I don't know if you've ever had one of these, but it's a dental specific CT scan, and it's absolutely changed my practice 100%. I see things, these hidden infections that I never could see before. And we have people that you cannot believe the stories. Just barely before we had to close, I had a patient who was losing all of his hearing. And he'd been to so many places, and he's blind. He's already blind from glaucoma. So he's blind and he's losing his hearing. So that's his only sense that's left. And he said he was terrified. And he didn't tell me this ahead of time, actually. He said he was terrified. We found some hidden infections in his jaw where his wisdom teeth had been removed. They'd been there for 40 years. And he came back 2 weeks after, and he said, I didn't tell you this before. He said, but my hearing's 100% back. It's back now.
Like, there's a lot of people that have gotten their wisdom teeth out. And like, even like me, and I still feel that I'm still struggling with some of the things that happened. How long has it been? Like 20 years ago that I got them out.
Yeah.
And so like, when you say, when people think they're going to have to go get a CT scan, like, is it kind of like a thermography? Like, what is it that
Are you talking about that cone thing that goes around the face and kind of?
Mm-hmm. Yeah. It's called a cone beam CT scan. So it's dental specific. So it's not like you don't have to go to a hospital. You don't have to go to a radiology center. A dentist will have it in their office. The ones that are using this technology, which should be everyone, they'll have it in their office.
But the majority still don't have it, right?
The majority don't. A biologic dentist.
They're not inexpensive, right? I mean, they're pricey.
They're $100,000.
Right, yeah.
$100,000 is all. So. No, but you have to have it. You just cannot practice this kind of dentistry without it. Like you said, you have symptoms or things. So many adrenal energy issues are related to those wisdom teeth sites that never healed properly. So many heart issues are related to those wisdom teeth sites that didn't heal properly. So that one's an enormous one. If you're seeking out a biologic dentist, make sure they're taking a CT scan, because there's things that we see on there that we can never see. Yep, they're called. Okay. Yep. Cavitations, failed root canals. That's all going to be evident on those CT scans. Yeah. You can't believe the things. And I can see all sorts of things. I can see airway issues, spinal issues. I can see brain issues. I can see all kinds of things. So Yeah, we talk about all that. Another thing that for sure you ought to make sure a biologic dentist is doing is talking nutrition as well. I was just speaking to a patient this morning and she said, oh, I've had this gum disease forever and they just keep wanting to laser. And I said, that's great, as long as it's just not a nutritional issue. If it's a nutritional issue, they can laser all day long, every day.
Right.
But there's a ton of nutritional issues that go into dental disease. I tell people my goal is that you never have another cavity again in your life, and I can help you do that. That you never have gum disease again, and we can help you do that. It's all talking nutrition and the right way to incorporate it, how to heal dental disease, all sorts of things. So biologic dentists should be able to help you with that too. The fourth thing, the last one we'll cover is just airway. There's so many things that go into airway, and that's breathing, sleeping, how much oxygen gets to your brain. It affects growth and development. So this is huge in kids. If a child snores, 100%, there's airway issues that can lead to all sorts of learning disabilities, ADHD, ADD, sleeping issues, bedwetting issues, all are related to that. Those closed airways. So that is something your biologic dentist should be addressing, as well as for sure adults. If anyone snores, if you snore at all, child or adult, it doesn't matter. You have an obstructed airway. You're not getting adequate oxygen and your brain is not functioning the way it should. So those are just
a
things.
mouthpiece, is that what you do for that?
There's a lot of different things. For a child, there's actually something called interceptive orthodontic treatment, where you have mouthpieces that they use to direct the growth. And it makes it so the airway actually grows the correct way, as well as prevents need for braces and other things in the future. It's amazing. We've been able to see people completely turn around, kids completely, the ADD is gone completely. All of a sudden they can focus again because they're sleeping at night. And adults, there's another appliance that we use, because I don't like the mouthpieces. What they actually do is bring the jaw forward in a way that could be damaging to the joint itself. So we have an appliance that we use that can change the growth in an adult even. It uses epigenetics and it changes the growth, and so that it actually makes the mouth, it makes more room available in the mouth for breathing. And we can actually fix someone so you don't have to wear an appliance or a mouthpiece for life. We also have a laser that you can use to shrink up the tissue in the back of the throat so that the snoring stops. So there's a lot of different ways. I'm not about using Band-Aids. I'm about using things that actually fix the root of the problem. So we have a lot of things to do that as well. So those are 4 huge ones that I would make sure of when you go to a biologic dentist. And you're not going to find it with all of them. Some of them may do safe mercury removal. Some may talk a little bit about nutrition. Make sure you find somebody that does it all.
Yes.
Excellent. So how did you personally, you got into dentistry because you had your own health, or this kind of dentistry because you had your own health crisis.
Right.
So as soon as you realized, oh, hey, this might be mercury, you're like, well, maybe if I get rid of the mercury, then I can still practice and I can still go on. And then that led you on the path to what you've been doing with all this stuff, right?
Exactly.
And we've talked a lot of things about what you're doing differently in your practice, but overall, what are the main things that you would say is different about what you do versus a standard regular dentist? Is it just protection? Is it just the nutrition, or is there more other little things as well?
Medicine started down a path of specialization, where they decided that if you have, an ear issue, then you go to an ear doctor. If you have a gut issue, then you go to a gut doctor. They really started this idea that the body is in separate pieces and
Right.
separate parts, and one part doesn't affect another. Well, as well as anybody that that's not true. We're all connected head to toe. Well, dentists fell into that same trap, and we became teeth mechanics. So we drill on teeth, we pack little things in them, we make them look all nice, we shine them up, and we send you out the door. We've done nothing but be a mechanic, just like a car mechanic would be for your car. They change your oil, they do it, that's all that dentistry really has evolved into. Well, unfortunately, that's ignoring the fact that the mouth is connected to the rest of the body. And the gums are just the start of the digestive system. So it starts up here in the sinuses in the mouth. That's the start of the digestive system. If you have a problem here, it's all the way throughout. The teeth themselves are every single tooth that's connected to an organ system somewhere in the body. There's research that shows that if you have cancer,
that chart in my office.
Yep, the chart, exactly what I'm talking about. Yeah, if you have cancer somewhere, you have a dead tooth somewhere, a dead tooth or a cavitation somewhere, and it's most likely on that same energy line or that same organ line. So I think the big thing that we do in our office is we realize the connection. We realize that your teeth are hugely connected to the rest of you. And to treat the teeth without treating the rest of you is a little silly. So we don't do it all, obviously. We're dentists, but we have a great network of people we can help you find, or we share a lot of information with I talk a lot with my patients. I share a lot with my patients and really guide them on the way to the health, not just the way to dental health, but overall health. And that's what I think really is different about us, is we realize it's all connected. And, my personal goal is to save America's health, whatever it might be, one tooth, one mercury filling, one crown, one root canal, one thing at a time. And in order to do that, I have to realize it's all connected, and that I have a huge part to play in the health of my patients that are coming to me. So that's the big piece. It's very different when you come in our office. It's very different. It doesn't feel like a dental office, because we're really talking about so many more things than you ever have been talked about at a dentist before.
So maybe what are like 3 things that you find in the mouth that can affect people's health, overall health? If you're just doing your first initial exam, like the top 3 things you think, okay, if I see this, if I see this, if I see that, we know there's some going on.
Metals, infection, breathing. Those are my top 3, always. So if there's metals, if there's mercury filling or metals under crown, sometimes they hide. If you have a black line around the gum line, most likely it's a crown that has a metal core with porcelain over top. So metals is number 1. Any metal in a mouth will cause a battery. That battery steals electrons from your body. So I tell people it's like leaving the light on in your car at night. It's not a big battery. It's not a big drain, but it's a slow enough drain that it will just drain your energy constantly. So metals are number 1. The second is infection. Those are the failed root canals that don't hurt. And the cavitations, I don't like to use the word cavitation, but you may have heard that word before. I just like to call it places where the bone hasn't healed, the jaw hasn't healed properly after a tooth is removed. How many people had wisdom teeth removed, or people don't think about this one often, or teeth out for braces? Heaven forbid, we would never do that anymore. But if they did, there was a whole generation of people around my mother's age that had 4 teeth removed for braces. Those areas can have places that the bone didn't heal properly as well. That's the second one. Infections, either root canals or wisdom teeth or other tooth removal areas. And then the third one is breathing. Breathing, you cannot believe the life effects that it has if you cannot breathe properly. And you just most people don't realize they're not. There's all sorts of signs.
Do you send them to like a sleep study test to get that done then?
We have all sorts of things that we test in the mouth. So there's signs in the mouth and cool things I can talk about that you can look for yourself. Even things like it's called scalloping on the sides of your tongue, little indents on the side of your tongue, a fissure down the middle or a crack down the middle of your tongue, lines on the inside of your cheeks. We look for all these signs and symptoms. And then we have, in office, we just have a pulse oximeter that tests are you breathing awake? And then we actually have a service that sends the test to your home. So you don't have to go to a sleep center. They send the test to your home. You take a 2-night Cinero, send it back, and we can give you the results and tell you what we find. But more often than not, just looking in your mouth, I can tell you if you have a sleep issue. There's many signs that we can look for.
Huh. Well, your patients are very blessed to have you with all the knowledge that you have and how you're able to help them in such a different way that you went above and beyond what normal patients would be able to experience in another office. So thank you for going above and beyond and teaching us and even giving us a lot of great information today.
You're welcome. So happy I could.
Just a couple other things, because things that that we wanted to ask you about would be like, what are maybe some specific products that you recommend? Because, everyone has, like on the dental industry, they're all regular toothpaste is totally fine. Then you go into some places like, oh no, that stuff has toxins in it. So there's that kind of question. So stuff like that. What are some things that you actually recommend? And then things that people can do to prevent stuff on their own?
So the commercials that say 9 out of 10 dentists recommend? Well, I'm the 1 out of 10 that doesn't. I'm the one. It's me. So if you look on the ingredients on most toothpastes, you're going to find things that are in
things you can't say. So therefore,
antifreeze. You're going to find antifreeze ingredients. You're going to find triclosan, which is a surface disinfectant. You're going to find sodium lauryl sulfate. You're going to find all sorts of things. Yeah, you can't produce or you can't pronounce. And people will say, oh, I don't swallow it. Guess what? Your gums are a single cell thick. And even if you don't swallow it, it's going to get through your tissue. There's no way you're not going to get it into your body. So if you don't really want to eat those things, don't put them in a toothpaste and put it in your mouth. So I love toothpastes that have basic ingredients. You should be able to read on there and see dirt, water, some clay, maybe some essential oil, maybe a little bit of stevia for sweetener. That's it. That's all you need. Whether it's in a powder or paste form, I don't care. I love one called Earth Paste. It's from a company in Utah called Redmond. There's a lot of different knockoffs. We have a recipe on our website that you can make your own version of it. It's basically that: clay, water, some essential oil, and some sweetener, and that's it. So that's all you need for toothpaste. As far as mouth rinse, all the mouth rinses that are on the most everything that's in the store has a high alcohol content.
Right.
Well, that actually dries out your mouth, which creates worse bad breath. What's great for the mouthwash company, super bad for you. So you don't want that alcohol in your mouth. And not only does it do that, but it kills off the normal oral bacteria and the normal gut bacteria. So the more you use Listerine, you're killing off your gut bacteria. You're throwing off your whole biome, top and bottom. So don't use alcohol-containing mouth rinses. The one I love to use is called salt water. It's just a simple dilute salt water. You can make it at home. So you don't need to support any of these companies. You can make your own stuff if you want. As far as keeping your teeth and mouth clean, those are two really good ways to do it. Make sure you take a lot of minerals, add a lot of minerals, and make sure your vitamin D levels are good. That's something you need to get a blood test, or at our office, we actually have a finger prick vitamin D test that we do for our patients as well. Tells us where the levels are, and that's one huge key component to keeping teeth healthy. Most people probably heard of Dr. Weston Price. I talk a lot about Weston Price. I love the man. And he taught us a lot about nutrition and how it affects dental and overall health. And we follow a lot of what Dr. Price taught, which is a lot of vitamin D, a lot of vitamin K. He didn't know the name of it at the time, but it's been since named vitamin K2. Those are all things that you need to have to stay healthy.
Excellent. No, that's really good. There's a lot of things out there that people just don't understand, but just basic stuff like that. So you said that, let's go to that. So what is your website? Let's go get them. So people, if they listen to this, they're able to reach out to you if they'd like to. So give us your information, your website, and email if you want, phone number, that kind of stuff. And then you said something about you have like on your website, you have something people can go look and download, like you said, how to make the toothpaste.
Yep. Everything's on our website. We have a ton of information on there right now. I have really some new information. I just did a whole section on earthquakes and disaster prevention. Actually, can't prevent a disaster, but disaster preparation. I'm doing a whole segment on gardening this week. We did something last week on how to make your food budget stretch. So go online. It's www.totalcaredental.com. If you click the health info tab at the top, you're going to run into all this stuff. I just put a recipe on there this morning. So again, totalcaredental.com. The phone number there is 801-756-3737. And wherever you are, we do virtual consults as well. We have patients that come from all over the world to see us. So we do virtual consultations and can do a lot of it online actually before you actually come and get the dental work done. So that's a great way if you are not local to the Utah area. We have a lot of people that come and get the dental work done all in one fell swoop here while they're visiting our beautiful state. Not right now, but maybe in a month. Maybe in a month.
So we're recording this during the whole shutdown COVID-19 thing.
Yeah.
That's when we're recording this. And then did you want to, I think you wanted to give a special, if people hear this, they can call and get a special price on that?
On the virtual.
Yes. Thank you for saying that. Yes. Special price of virtual consultation, $49. It's regularly $179. So this is a huge deal. Yep. So $49, doesn't matter where you live. I just did one this morning from a woman in Jackson Hole, Wyoming. So we love to help people, and the more we can do that, the better.
That is awesome. That is awesome. Is there anything else that we missed that you think might be important for our listeners to hear that we haven't talked about? I mean, I know there's a lot out there, but just something basic or anything. If not, that's great. But, did we miss anything that you wanted to be able to share with those who are listening?
There's just one quote that I really like. It was from a doctor in a recent book. I think it was 2017 book that talked about if you have health issues that don't seem to be resolving, no matter what you are doing, you've gone to all the doctors, you've done all the health advice, you're taking all the supplements, you're doing everything right, and you just seem stuck, try the dentist. It may be the dentist, and maybe that you have some metal, and maybe that you have some hidden infection, maybe that you're not sleeping, that you're not breathing. Try the dentist. Oftentimes it is the thing that tips the scale. We talk about this all the time, that tips the scale from disease to health. And it's something you don't instinctively think about.
No, not at all. And I would say,
if you're stuck,
don't just try that dentist, try a biological holistic.
Thank you. Thank you. Because just a regular dentist probably isn't going to help you.
Yeah, isn't going to see those things. That is so true. So true.
Yep.
Well, thank you so much. Appreciate what you do, and appreciate you being involved in what we're trying to do as well. And thanks for being on our podcast. So
thank you,
and enjoy your day.
You as well.